Here we have a patient who's come to us with a complaint of the surgical scar. So he's a known case of cleft lip operated when he in the childhood. So if you see that he has a surgical scar over here with vermilion notching that's present, and the scar is quite wide. So today we'll be doing two things. We'll be doing a revision lip surgery where we'll be correcting the surgical scar and making it a thin line, and also correcting the vermilion notching that's present over here.
So we are about to start this very subtle lip revision. Couple of issues. You can see the depression on the lip. He lacks a tubercle and also scar and the shape of the lip. You can try and address all of this in this surgery. And this is immediately on completion. So a lot of muscle work has been done besides work on the skin. So we've increased the fullness of the lip. You can see a little bit of the tubercle has been reconstructed. The lip has been made fuller into a better shape. Okay, sir.
Okay, fine. Next. कैसे हो आप?
Third day. First day, second day. Second day.
Okay, nice. I think morning she might have done dressing. It's looking nice, clean.
सुबह ड्रेसिंग हुई थी. He's eating soft food.
हाँ. ठीक है, अच्छा है. ठीक है, आपको सबसे पूछ के बताऊंगा आपको डिस्चार्ज के बारे में. हम पॉसिबल तो आज ही कर देंगे, नहीं तो कल.